Hi everyone, my name is Huy Nguyen and I'm a senior nursing student at SWASU of class of 2015. And right now I want to talk to you guys about intravenous medication administration safety. So when you guys go into nursing school and begin your clinical, especially from the second semester, you hear a lot about IV push, IV bolus, IVP. So what it is? Let's find out. So IVP stands for intravenous push, and its other name is intravenous bolus. And what it means is that you give medication directly to the vein, to the bloodstream, by using a syringe through an intravenous catheter. And an intravenous catheter is like a plastic tube, plastic flexible tube that you put into a patient's vein, and you can give fluid, you can give medication through that, and you can also draw patient's blood. But we'll get into that later when you get into nursing school. So why intravenous? What's the benefits of giving medication through the vein? The biggest benefit is that the medication get absorbed directly into the bloodstream. So it has a very fast onset of action, and the effects of the medication can be seen like almost immediately. And because it's very fast acting, and because of those benefits, IV push usually used to rapidly control heart rate, respiration, blood pressure, cardiac output, and pain. And it's used a lot in your clinical site. In a more critical care setting, it's been used a lot. But IV push is the most potent route of administration, but it's also the most dangerous route of administration. Why? Because you are giving medication right into the bloodstream, and it's act very fast. So if there's any side effects, any toxicity, any allergic reaction, they also will happen very fast, and the patient can become, life-threatening and fatal in just a matter of seconds. Sometimes they can die without you even have time to do anything about it. So, because it is widely used, because it is very dangerous, that's why we have to have medication administration safety. And this is the main part that I want to talk to you guys for today. The two things you need to remember after today, talk is the 6 W's and the 6 W's and the 6 R's of intravenous medication administration safety. So let's go over these 6 W's first, okay? So, obviously, before you want to give a medication, you have to know what the medication is. Like, are you going to give morphine? Are you going to give a beta blocker? Are you going to give, Lasix kind of thing? You have to know what the medication you're going to give. And you can do that in your clinical site by, open up the chart, see the orders, and you will know what the medication is. And you have to know its purpose. Like if you're going to give morphine, what do you give it for? Obviously for pain. So you have to know what medication you're giving and why you give it. Important thing, what are the side effects? So you need to know this. The side effects are important. Whenever you give a medication, you have to anticipate what can go wrong so you can anticipate the proper intervention. Like for example, if you're giving morphine, morphine has a serious side effect of causing respiratory depression. I'll write it right here. Respiratory depression. What it means is that for some reason you give too much morphine, patient got overdosed or you give morphine too fast, the patient's body cannot handle it, patient will not breathe. And when they are not breathing, they won't have any oxygen. And when they're not having oxygen, they die. So very important that you know the side effects of each medication you're given. And that leads us to the next W. What to monitor before and after you give the medication. So, for example, morphine, you know it causes patient to not breathe very well. So what do you want to monitor? You want to monitor how the patient breathes. If he's breathing like easy, how many breaths per minute is he breathing? What's the oxygen saturation level, which is like the concentration of oxygen in your blood. You want to monitor that before and after you give the medication to make sure your patient is okay. And this is a big thing right here. What is the rate of delivery? IV push, although they are administered in a relatively short amount of time, like usually less than 5 minutes, but it's very, very important that you know the rate of delivery, because if you give the medication too fast, patient bodies can't handle it. Bad things will occur. And this you can look up on your Unbound Medicine. It will be a mandatory app on your phone, and you know about it later when you get into nursing school. But basically, it's like a dictionary for nursing. You can pull up any drugs, you can see everything about it. And for morphine, you will want to deliver it more than 5 minutes. So, example, you got a syringe like this with morphine. You want to you don't want to slam it like this or give it fast. You want to look at your clock, give it a little bit of time, like this, like this. After the 5 minute mark pass. Very important, remember this. And then you need to know what is the recommended dosage. You might ask yourself, why do I need to know that? Isn't it the doctor's responsibility for the dosage? Doctors are human too. Sometimes they can make mistakes. And you, as a healthcare professional, you need to know the right dose so that if there's a mistake from the doctor, you can realize that, oh, this dose is wrong. Is that, something is wrong with this order. I need to double check. I need to double check with the doctor. So you need to call the doctor and ask, do you really want to give this much medication? And if there's a mistake, the doctor will, try to fix it, and you save your patient's life. That's the 6 W's that you need to remember every time you give an IV push. Here is also a big question: to dilute or to not dilute. Some medication will require you to dilute it with some normal saline, some not, and some it's just a matter of personal preference. But you need to look up in Unbound Medicine for this. And one tip: whenever you give morphine, you always want to dilute it with some normal saline, because it makes your patient feels better and reduce the risk of serious side effects. And after the 6 W's, you also have to know the 6 R's of medication administration safety. And I believe you all know what it is. You need to check if it's the right patient, if it's the right medication, the right dose, the right time, right route, and right documentation. And you also need to check for allergies. And how many times do you do this? 3 times. Before you prepare the medication, after you have drawn up the medication into the syringe, and at the patient's bedside. Alright, so these are the most important things that you need to remember from this talk today. And so that's that. And now I just want to share some advice with you, fellow SWASU students who will be in nursing school next semester, and the juniors who are taking, their first semester. You'll be, as I said before, you'll be giving your first IV pushes in the second semester in a class called Acute and Chronic Care 1. So basically what that class is you are going to a real hospital. You're going to the inpatient or the med surg unit, and you follow a nurse doing what she does, giving medication, doing assessment kind of thing. And yeah, and you need and you will have to be checked off by your instructor. Um, just like as other skills that you have been checked off before you can give any IV push. And this is the important thing. You never, ever, 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 ever give an IV push without an instructor. You have to have an instructor whenever you give an IV push. You might think, oh, I'm with a nurse. There's an RN right here. I can give, the IV push with an RN. No. Even if you're with an RN, even if you're with a doctor or something, you still need your instructor to be with you whenever you give the IV push. Or you might think, this skill I'm getting checked off, like I'm getting checked off in Foley, so I can do it by myself or with a nurse. I don't need an instructor. IV push is not like that. IV push, even after you get checked off, you still need to have your instructor with you when you're delivering the medication. And you might say, oh, I'm in clinical, so I'm busy, and my patient is in, he needs the medication like now. I cannot wait. I have to give this medication. In case you cannot wait, you have to skip that opportunity. But if you anticipate that you're going to give an IV push, text your instructor, and they are really fast in replying. They'll say something. You need to say something like, Miss Weimer, Miss Kennedy, Miss Bell. I'm going to give morphine IV push in about 10 more minutes, or I'm going to give the medication now. Can you please come? And they'll probably reply you in the next 3 seconds. And they'll say, on my way, I'm coming, kind of thing. And you have to wait for them to come before you can do anything with the IV push. All right. And I talked about the 6Ws, the medication purpose, side effects, and what to monitor, and what's the rate of delivery, and everything. You can find all the information on Unbound Medicine. The instructors will get to you, get that part to you later when you're in nursing school. But as I said, it's like a dictionary for nursing. You can put it up in your phone for everything you need to know about drug. And it's your best friend. And you better be prepared, because when your instructor comes, they will ask you about the medication. They will ask the 6Ws. They'll ask you what's the medication you are going to give and what the side effect, purpose, everything. So you need to be prepared to answer the questions whenever the instructor comes. Yeah, that's about it. I know what you're thinking. You're thinking, this is so troublesome. This is so counterproductive. It wastes a lot of time in my clinical. This limits my opportunity to practice my skill. Why are we doing this? I went through it. And I thought like you too. I think this is a waste of time. It's just a medication, and I have a nurse over here. But do remember this. It all seems troublesome, but it's all to protect you. It's to protect you. It's not to protect the school. It's not to protect the nurse. Well, it's there to protect the patient, but it's also there to protect you. Because, if you're with a nurse and you give an IV push medication and there's something wrong, do you think that nurse will risk their career trying to save you? No, because you are the one who actually pushed the medication. But if there's an instructor there, she can ensure safety for both the patient and both for you. So all that troublesome thingy is to protect you, your hard work in nursing school, your future license, and your future career as an RN. So keep that in mind. Let it sink in your head. It's all for you. So that's it for today. Yeah, that's about everything. So, this is a videotape, so I don't really have the chance for you guys to have any questions or anything. But your instructors are great resources. You can ask them about everything, and then if you have any question, you can always find one of the seniors, and we'll try to answer your question in as details as possible if you know the answer. All right, so Thank you for listening, and for people in the intro to nursing, I wish you luck getting into nursing school. It will be a very rough journey. It will be very challenging, but it will be very rewarding, and it will go by fast. And for juniors, I know it's been rough right now with pharmacology and all that stuff, but hang in there. You get better. It will get better. And 2 years will went by pretty fast. Just hang in there, take one step at a time, have one bite at a time, and you'll be fine. All right. Thank you for listening, and have a good day.